This is Marcela Márquez, and I will do a presentation about pediatric pituitary adenomas. In the first part is an overview of pituitary adenomas, and the second part about the 43 results of pediatric pituitary adenomas found in northeast of Mexico. The pituitary gland, or hypophysis, is an endocrine gland about the size of a pea. The hypophysis rests upon an hypophyseal fossa and the sphenoid bone in the center of the middle cranial fossa, and is surrounded by a small bony cavity, the sella turcica, covered on dural fold, the diaphragma sellae. Although rare, all intercranial neoplasma of children, 5% is pituitary adenomas. An early diagnosis and effective management are critical for reducing morbidity and minimizing mortality. While hormone-secreting pituitary adenomas are typically histologically benign, there are significant morbidity via direct mass effect on neurovascular structures and or hypersecretion of hormones, resulting in shortened life span. Potential physiological sequelae from these tumors can affect a child development. One of the pituitary disease is the pituitary adenomas, non-cancerous tumors that can adversely affect by an over and under production of associated hormones. The pituitary control physiological process as including stress, growth, reproduction, and lactation. Invasive adenomas grow into adjacent structures such the sphenoid tissues, bone, and the cavernous sinus. The MRI is the base tool to classify invasion, and the Wilson-Hardy grading system is widely used. The invasiveness is demonstrated in the yellow line. The sella turcica tumors can be non-invasive when it's grade 0, grade 1, and grade 2, or invasive grade 3 and grade 4. Symmetricity is demonstrated in the red line, and the elongation of the tumor in the blue line. About the etiology of these tumors, studies have done about pituitary microadenomas and have then seen develop these tumors when DNA mutations cause cells in the pituitary gland grow and divide uncontrollably. The pituitary gland is important for mediating the stress response. Critically, pituitary gland growth during adolescence can be altered by early life stress, such as childhood maltreatment or maternal dysphoric behaviors. Pituitary adenomas, as I say, are benign, but treatment resistance remains a major concern. The existence of stem cells within benign tumors is still debated. The presence of adult stem cells in human pituitaries, where they sustain the high plasticity of hormone-producing cells, allowed the hypothesis that putative tumor stem cells may exist in pituitary adenomas, reinforcing the concept that the cancer stem cells model will also be applied to the pituitary tumorigenesis. Genetic alterations in human pituitary stem cells results in pituitary adenomas stem cells development, leading to pituitary adenomas treatment resistance. This is the ideal tool for the pituitary adenomas diagnosis. There are very few genetic studies because the rarity of these tumors and the availability of the tumors only in surgical resection and limitation of the genetic tools. The immuno-histology or the pituitary adenoma samples have been used. For example, the nestin that stain functional adenomas, especially for the growth hormone, the prolactinome, the gonadotropin secreting adenomas, the SOX2 that stain the ACTH secreting adenomas. And to estimate the progression, we have the KE67 for the evaluation of the proliferation index and the evaluation of the mitotic index or the P53 protein expression. This is the pediatric pituitary adenomas logistic that is
118呀？哦，怎么了？他是那个500多的打折下118吧？
excuse me, can you close your microphone?
你看到的是多少钱？
我看到了，我是100。
Excuse me, can you close your microphone, please?
Hello, Dr.
Yes.
Adenoma, please mute your microphone.
Yes. Okay. This is the pediatric pituitary adenomas therapy logistic. In the left side, we have the logistic for prolactinome, and in the right side, the no functional, the growth hormone, and the ACTH logistic. The purpose of this study is to review the incidence, the treatment, and the outcome of the pediatric pituitary adenomas. The investigation of the incidence of one disease in Mexico, especially rare, as the pituitary adenomas, is difficult and will always be an approximation. This is due to several factors, and the most significant is the lack of central recording, the recording of the diagnosis, the treatment, or the follow-up recording. In several parts in Mexico, this recording is subdeveloped. Another affecting factor is the poverty, because of the total population of 128 million in Mexico, 50% lives in various stages of poverty, and this affects the treatment and outcome of the patients. Excuse me. The population of the patients, they were less of 90 years old, and they were treated and follow up during a period of 20 years in Mexico. The data was collected in the metropolitan area of Monterrey and city in the north of Mexico, being the most developed area also in terms of recording. It was one single hospital involved and covers a population of 4 million of persons. In this study, we found 1,244 pituitary adenomas. In total cases, we have found 43, that means, and 3% of these kind of patients. And that means we have found in these 20 years, approximately 2 children by year. This is the evaluation of diagnostic workup. We have not made any molecular study with KE67 proliferation index, not with the P53 protein expression for the mitotic index, in no genetic studies also. The evaluation of the patient complete response was considered when a patient reached 12 months with normal values of prolactin, ACTH, etc. No visible tumor in an MRI scan, and regression of symptoms. These limitations, our results apparently follow what had been reported previously regarding the pathology and its incidence among children and adolescents. no family history with pediatric pituitary adenomas was found. The treatment strategies are tailored to the specific adenoma subtype and can include surgical resection, medical therapy, and radiation therapy. Now we pass to the results. This is the age and gender distribution. We can see that we have found patients from 13 to 90 years old. In the majority of the patients were between 16 and 19 years old, and the females were the majority of the patients. In the clinical presentation showed that predominant tumors were prolactinoma and the rare not functioning or not secreting pituitary adenomas that there are very rare also to found. Also, most of the identified pituitary adenomas are incidental findings without the need for intervention. Some may present as clinical significant because they secrete the hormones or cause symptoms for compression or invasion of the surrounding tissues. About the tumor, macro and micropituitary adenomas were found in the prolactinoma here, that they were majority. And we have seen that the macroadenomas indicating for all the others indicating that the patients arrive in late diagnosis. The majority of the prolactinomas related were not invasive. The rest of the tumors, they were highly invasive. The pituitary adenoma size with grade 1 and 2, they were found in predominant in the prolactinomas. Tumors of grade 3, they were found in the non-functioning and the growth hormones. In resume, the macroadenomas were the most predominant and 70%. Inside were the prolactinomas 63%, non-functioning adenomas 21%. 40% were diagnosed as invasive. About the pituitary adenoma size and the body mass index, in this study, we can see that the majority of the macroadenomas, they were overweight. And in together, between the overweight of the microadenomas and the microadenomas is around 60%. Where of the patients that were overweight or obese. This is the prolactin secreting adenoma symptoms with the principally it was this amenorrhea, galactorrhea, headaches, and obesity. And we compare with all the others, the not functioning adenomas, we can found that have headaches, visual disturbance, overweight, and hypothyroidism. And the growth hormone, they have a real gamma of symptoms. The treatment strategies, the cabergoline or bromocriptine, they were, it was depend of the price. The bromocriptine it was cheaper, but it needs 3 to 6 doses by day. And the cabergoline is only one dose per week, but is more expensive, but present less side effects and is more tolerable. Frontotemporal surgery is not generally used for this kind of tumors, but in our cases, the patients, they arrive late and they have extracellular extension. About the prolactinoma treatment, dopamine agonist was used as an initial therapy to normalize prolactin values and decrease the tumor size, and controlling symptoms in secondary to hormonal and neurological alterations. In case of resistance to dopamine agonists, this surgery was considered, and in third line, the radiotherapy. Even we have a case with very aggressive that this prolactinome convert to be cancer, and chemotherapy was used. This is all the other cases of patients' treatment. We can see that surgery was used in almost all the cases of invasive and no response in 4 weeks patients. The time of complete response, we can see that the growth hormones needs almost the double time to have a response if we compare with the non-functional secreting tumors. It was with a media of 43 months of response time. About the response, treatment response, normally the doctor waits 3 months to see if there are a response for the first therapy, and 68% had complete treatment response without any sign of disease. It was 4 cases that was cured only with surgery. 2 cases of this, they need repeating surgery. In 1 case, any treatment was necessary because it was a spontaneous regression of the tumor. Chemotherapy was used in 1 aggressive prolactinoma, and the follow-up media, it was 104 months for the patients. The treatment failures, 31% did not respond to any treatment, and it was aggressive tumors that it was impossible to operate because it was invasion to the cavernous sinus or invasion to the carotid artery. 3 patients died because of cerebral stem invasion and cephalorachidem with fistula with meningitis, or another with late intervention. The causes of the treatment failure, it was treatment resistant in 13 cases because it's possible for the late diagnosis and or extreme childhood mental stress. The late intervention or advanced disease, they need more training for the pediatrician to have an early diagnosis of these kind of tumors, or the children's family cannot afford the examination in early symptoms or waiting time to reach medical care. Also, there are poor patient compliance because they didn't have money for the transport for the clinic. They come from very far away places to this clinic. 2 of the patients refused the treatment for fatalistic view of the disease. About the pediatric this kind of tumors follow-up, needs a lifelong low dose of carvedilol, continuous and prophylactic treatment between the evaluations to keep the prolactin values normalized. An evaluation during the first three months during the 3 first years after cure, and after this, and single evaluation per year. Is it very important that the follow-up all lifelong, because these kind of tumors, the behavior are unpredictable. Important is that these children have to have an environment without stress or minimizing the stress to avoid the rise of the stress hormones. In discussions, it is possible that these pituitary prolactinomas in Mexico are underdiagnosed, since the children are in the age of 12 to 90 years old, 40% are obese. And in this study, we have found 68 of the patients with cases with overweight or obesity. Surgical outcomes, gross total resection is the key importance, because the possible recurrence due to residual stem cells in the place of the pituitary, particularly for the non-functioning adenomas. And the presence of residual disease can necessitate adjuvant medical therapy, radiosurgery, place the patient and the right future risk of problems, visual problems or pituitary dysfunction. In conclusion, the Mexican children obesity precludes pituitary adenomas early diagnosis. Although these pediatric pituitary adenomas are rare, it needs to be very carefully diagnosed and identified in the early stage with a subsequent therapeutic intervention. We need more information about diagnostic and molecular markers to identify and predict what will happen with this progression of the tumors. Also, several markers, it will be ideal to need for an estimate this progression of these tumors. Therapy and a permanent follow-up is the key of optimal care to have a successful outcome for the patients. Measures to ensure the compliance with sustained therapy and follow-up needs to be improved in a socioeconomic diversity population as Mexico. Thank you for your attention. This work was a collaboration between the Dr. Lucía Torres from the Instituto Mexicano del Seguro Social, Dr. Ricardo Cerda Flores de la Universidad Autónoma de Nuevo León, and myself, Marcela Márquez from the Karolinska Institute. This is the reference of this that was support this presentation. And if you have some question, here is my email address. Thank you for your attention.
Thank you, Dr. Marcela Márquez. Thank you for your valuable presentation. And now the session is open for the questions. If anyone had any questions, please drop your questions in the chat box. I repeat, if anyone had any questions, please drop your questions in the chat box, or else unmute your audio and shoot your questions to Dr. Marcela Márquez so that she will be answering your questions. Besides, we'll also be leaving the mail ID of Dr. Marcela Márquez so that you can reach her by dropping the mail.
Good. Could I ask a question?
Yeah. Yes, please.
Yes, hello. A very interesting presentation. Do we have, as yet, anything, we know anything about the genesis, in fact, actually, of pituitary adenomas? Over the years, I've treated an awful lot of patients with pituitary adenomas, but I'm still very ignorant about the genesis. And I know nothing, in fact, about the genetic aspects.
Yes, you know, this, there are only one review about studies of genetic studies of this patient. It's not for sure that it's a genetic problem, if I well understand. I think that we are in the beginning as I said, it's very difficult to study the genetics of these tumors because we need the tumors in this during a surgical resection. And for example, in the case of the prolactinomes, it's impossible because normally these tumors that are not operated. Yes, they need, they can be only treated with dopamine agonist.
Sure.
Yes, but I think maybe what can be interesting is to know if there are some genes that can be related with cancers, even why not cancers, brain cancers, tumor cancers, because the structures are very close, and also this tumor is placed in a very particular part of the brain. Yes, and we don't know, it can be an interaction if there are some, for example, some stem cells close, you know. If I'm free to say, I think it will be very good when it will be on resection, if there are opportunity on resection to do a target molecule to destroy if there are some stem cells malignant in the in this kind of tumors. I think.
Very good, thank you.
Thank you.
Thank you both of you for your Q&A. I thought everyone got some idea about everything. Okay, thank you, Dr. Marcela Márquez, for your answers.
Thank you.
And
Thank you. Thank you for the invitation. Thank you. Bye-bye. Bye-bye.